What is coronavirus disease 2019 or COVID-19? Well, coronavirus disease 2019 or COVID-19 is a respiratory illness that can spread from person to person. The virus that causes COVID-19 is a novel coronavirus that was first identified during an investigation into an outbreak in Wuhan, China. So, my question is, can people in the US get COVID 19? Well, the answer is yes. COVID 19 is spreading from person to person in parts of the United States. Well, the risk of the infection with COVID 19 is higher for people who are close contacts of someone known to have COVID 19. Well, for example, healthcare workers or household members. Other people at higher risk for infections are those who live in or have recently been in an area with ongoing spread of COVID 19. Well, have there been cases of COVID 19 in the US or in the Philippines? Well, the Philippines right now, yes. In fact, there is already yesterday there was already 24 cases of COVID 19 in Manila. And also in the US, the first case of COVID 19 was reported in January 21, 2020. Well, the current count of cases of COVID 19 in the United States is available in CDC's webpage. Well, you want to know, like, how does COVID 19 spread? Well, the virus that causes COVID 19 probably emerged from an animal source but is now spreading from person to person. While the virus is thought to spread mainly between people who are in close contact with one another within 6 feet, imagine that, through respiratory droplets produced when an infected person coughs or sneezes. Well, it also may be possible that a person can get COVID 19 by touching a surface or object that has the virus or on it, and then touching their own mouth, nose, or possibly their eyes. Wow. But this is not thought to be the main way the virus spreads. Well, what are the symptoms of COVID 19? Well, patients with COVID 19 have had mild to severe respiratory illness with symptoms of number one, fever, two, cough, um, three is shortness of breath, and etc. Well, what are severe complications from this virus? Well, some patients have pneumonia in both lungs, multi-organ failure, and in some cases, death. So, if you want to know, like, how can you protect yourself from this virus? Well, people can help protect themselves from respiratory illness with everyday preventive actions. Well, first is avoid close contact with people who are sick. Second is avoid touching your eyes, nose, and mouth with unwashed hands. The third one will be wash your hands often with soap and water for at least 20 seconds. Use an alcohol based hand sanitizer that contains at least 60% alcohol if soap and water are not available. But imagine now, here in the Philippines, all of the pharmacies are not now let's say not selling 60% alcohol above. So there is shortage of alcohol, even mask here in the Philippines. Well, if you are sick, to keep from spreading respiratory illness to others, well, first is you should stay at home when you are sick. Well, cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. Well, what should you do if you recently traveled from an area with ongoing spread of COVID 19? Well, if you have traveled from an infected area, there may be restrictions on your movements from up to 2 weeks. If you develop symptoms during that period, like let's say fever, cough, trouble breathing, well, you need to seek medical advice. Call the office of your healthcare provider before you go and tell them about your travel and your symptoms. They will give you instructions on how to get care without exposing other people to your illness. While sick, avoid contact with people. Don't go out and delay any travel to reduce the possibility of spreading illness to others. The question is there any vaccine for COVID 19? Well, there is currently no vaccine to protect against COVID 19. The best way to prevent infection is to take everyday preventive actions like avoiding close contact,